And I just had faith that there was another treatment that would be less radical. For one thing, I was told that I might need to have chemotherapy, possibly some radiation in addition, and I know that both of those things are terribly destructive to the immune system and to the surrounding tissue. And I very much did not want to have any more damage done to my body than just treating the cancer specifically. So, in fact, I began what ended up to be a 21-year search, and during that time, after consulting with 3 surgeons and 2 oncologists and also many healers who also recommended that I do the conventional treatment, I decided to embark on a path of doing only holistic treatment, only quote-unquote alternative treatment. And I consulted a number of people over the years. I did dietary changes, exercise, yoga. I had supplements that were prescribed to me over time, and I tried many different treatments. For the first, I would say the first 9 years, the cancer was fairly stable. At one point, the tumor started to grow, but I took some Chinese herbs, which were able to stop the growth of the tumor and shrink it by stopping my menstrual periods, by cutting down on the estrogen through doing that. After 9 years, however, I was in a rather tempestuous relationship, and things became more stressful, and during that stressful period, the tumor started to grow, and that was in 1999. And from that point onward, the tumor steadily grew, and Dr. Chan asked me, and I looked at the list of people that I had seen over the years, and there were at least 20 different practitioners whom I saw over that period in my search of trying to find a cure for this cancer. One thing that I have to say is that I was very fortunate during this time, that my energy remained good, and I was able to exercise, I was able to work. But all the time I had just worry because I had this tumor in my breast and I never knew if it would spread to the rest of my body. In 1990, I was fortunate enough to meet Dr. George Wong, who's an herbalist in New York City, who works closely with Dr. Chan. And I've been taking his herbs for the last 12 years, I would say. However, I do feel that Dr. Wong's herbs were helpful in preventing the cancer to spread to the rest of my body, but nothing was able to stop the tumor. And even during that time, I became discouraged, and I finally went to an oncologist, and he gave me a pill. But the pill that he gave me had such terrible side effects that I had to stop taking it after 9 months. So, finally, after having tried all of these different treatments, I'm just really distracted by the conversation. Finally, I'm sorry, I'm getting thrown off by the. Finally, after trying many different systemic treatments and detoxification systems and what they call metabolic healing techniques, and after seeing a total of 20 different practitioners, Dr. Wong finally said, I know one person that can cure your cancer. And he recommended me to Dr. Chan. He said, this man is a miracle worker. He's the only person I know. And just to mention, Dr. Wong is a very educated person. He has a PhD from Harvard. He comes from a long line of Chinese herbalists. He goes to the San Antonio cancer conferences in the United States, very big. Everybody who deals with breast cancer goes to these conferences. So he knows he reads medical journals, so he knows the field. He knows what's available out there. And he said, Dr. Chan is the only person that can help you. So, not knowing what to expect, I came to see Dr. Chan. I was treated by Dr. Chan over a period of 1.5 years, and the reason it could have taken a lot shorter. It had to do with problems with my schedule and his schedule. I couldn't always get up here to see him. But actually it was about 1 year and 4 months. After 1 year and 4 months, Dr. Chan pronounced that my cancer was gone. 1.5 months after that, and it was a huge tumor. It was bigger than he anticipated, so it took longer than he thought. He called it an octopus. It was all spread out in many directions. That's what lobular cancer does. It spreads and kind of, it doesn't stay contained in one tumor. It has tentacles. And it was in my chest wall. It was in the muscles that connect the ribs. So it was this close to my heart. And at one point I started to go to conventional doctors, and I went to see some radiation oncologists, some doctors who specialized in doing radiation for cancer patients, and they were saying, oh, we'll just radiate here, and we'll radiate here, and maybe you'll lose some lung tissue, but it won't affect your heart. And I said, yeah, right. I mean, I know doctors well enough to know that they'll say anything to get you to do their treatment, and they never know what the side effects are going to be. So I kind of dismissed that option, and I knew that I'm very sensitive to any kind of medication. I mean, I can't even take an antihistamine. I knew that chemotherapy would just wreak havoc with my system, would really debilitate me very seriously, and it would take years for me to recover. So those options were out, and then the only other option was that pill that suppresses estrogen, and that gave me such terrible side effects. I didn't want to get up in the morning, so joint pain and so forth. So anyway, I did this series of treatments with Dr. Chan, and after we completed the treatments, a 1.5 months later, I had a PET CT scan, which is now considered the gold standard of tests for cancer. And I had also developed, just before I started the treatments, I developed a tumor in my shoulder, which meant that I had then 4th stage breast cancer. In other words, it had spread outside my breast and into another system. And that is considered an uncurable disease in Western medicine. And Dr. Chan treated that as well. As a matter of fact, he diagnosed it better than my doctor did. Truly, because I had a bone scan, and I called the doctor and I said, do you think that there's cancer in my shoulder? And he goes, no, I don't think it's cancer. And Dr. Chan said, it's cancer. Anyway, after the treatments, 1.5 months later, I had a PET CT, totally clear. No cancer. No cancer in the breast, no cancer in the shoulder. Had another PET CT, 6 months later, the same. No change, no cancer. I began to get a little nervous, and that's actually what brought me up here. I wanted to have another checkup with Dr. Chan, because I thought, the scar tissue seems to be changing a little bit, because of the type of treatment he does. I guess he described it, it's a poultice that draws out the toxins and it kills the cancer cells. There can be some scarring. Some people don't have scarring. I did have scarring because of the extent of my tumor. And he looked at it and he said, no, that's normal. It's just the way. And so when I go back, I'll have another PET CT, but I've been reassured by Dr. Chan that I have nothing to worry about. And, after 21 years, now 22 years, it's still a bit hard for me to believe that I'm really cured, and to take that anxiety totally out of my mind and to say that I have a future that's clear. But as more time goes on, I'm beginning to believe that more and more, and I remain eternally grateful to Dr. Chan. I totally agree with Dr. Wong. I don't think anybody else could have done what he did.
Thank you, Judy.
Thank you.
Thank you.
Thank you. Here is your. Okay.
今日咧就係Judy 佢今日簽咗啲鳴謝信俾我，就同我影個相紙咁。
You want to take a picture of it? Yes.
呢張英文嘅信同埋簽咗啲中文嘅信俾我，一鳴謝信嚟嘅。送英文俾你。